Welcome to Sharon Veronica Know Everything. We survived our ortho exam and now we're on to rheumatology, or so I thought, until we had a bone tumor lecture. So today we're going over bone tumors. We have 5 benign and 3 malignant bone tumors. So malignant meaning cancerous, benign they're not cancer now and hopefully they won't progress to cancer. So starting off with the first one, we have osteosarcoma. Sarcoma means a malignant bone tumor. So this is commonly in teens, and then there's also a second spike or second peak in people 50, 60-year-olds, but you can mostly think of osteosarcoma as a teenage problem. So on the bone here, you can see there's 2 radiographic findings, Codman's triangle and sunburst. So the Codman's is just kind of like a triangle. Sunburst, it kind of looks like a sun, the rays, just kind of going out like that. So under laboratory findings, you're going to see elevated ELK phos as well as ESR and CRP. So these are some more inflammatory markers. Signs and symptoms, pretty constitutional, fever, night sweats, and weight loss. So treatment for this, like other cancers, chemo and surgery. Something really important to remember with osteosarcoma is that it can commonly spread to the lungs. So as soon as you diagnose someone, you have to do a lung CT scan. Next we have Ewing sarcoma. This is also a more pediatric cancer, so 5 to 25 years old you can think. On X-ray you're going to see onion skin, which is a periosteum reaction. It's kind of like going out like an onion, like the layers, you can kind of see layers on the bone. So I think Ewing's onion, ew, onions. So that should help. And then kind of, once again, same constitutional symptoms, fever, pain, weight loss, treatment's the same, chemo, surgery, radiation. So the big differentiating factor is going to be radiographic, the onion skin versus common sunburst, in that Ewing sarcoma might not have as many lab findings as osteosarcoma. Next we have METs, bone METs to the bone. So this is when you have other cancer like lung, liver, what have you. Our main thing with this is going to be elevated serum calcium. So if you see elevated serum calcium and other things are normal, really think METs have spread to the bone because the bones start breaking down and liberating calcium into the blood. So bisphosphonates can slow the progression, but ultimately you're just going to have to treat the primary cancer. So that is the 3 malignant osteosarcoma, Ewing's, and bone METs. Bone METs think calcium, Ewing's, onion, osteosarcoma think Codman's and sunburst.
So I'm going to jump in and go over our benign bone tumors. So to begin with, we have an osteochondroma. This is going to be a painless growth on a long bone metaphyses. Typically it's going to be a single growth. It's very rare, but you can also have multiple. So I have a bone here. You can see that there is a growth right here. You're going to have 2 different growths. You're either going to have a pedunculated, which is away, so here, or a sessile. Typically the sessile may appear as a bone fragment that has not grown fully compared to the actual bone itself. This is pretty common in the knee and shoulder joints. As far as treatment, you're just going to be doing some observation, kind of keep an eye on it. Typically the patient's okay, it's not going to be affecting them. If surgery is going to be option if it's symptomatic. Now we're going to move down to the bone cyst. So we have a bone here, and on X-ray you'll be able to visualize it much better, but you can kind of see just like a cyst within the bone. And you can have different types. So one type is a fallen leaf sign. And so you can kind of see that the bone is starting to crumble due to the cyst, and there's just a small fragment that's fallen down to the bottom of the cyst. The proximal humeral head is the most common, and you'll typically see this in young patients. As far as the treatment, so you have non-operative and operative. Non-operative, you're just going to immobilize the joint. You can aspirate the fluid and then inject with steroids. And then an operative option would be to curage and bone grafting. So now we're down to a non-ossifying fibroma. So what you're going to see on X-ray is bubbles within the bone. These are typically painless. It's usually an incidental finding. As far as treatment, it's just observation because it's typically not going to be bothering the patient. Next we have an osteoid osteoma. So this is going to be very painful. So the patient's going to come in and say, like, I just have this non-stop pain in my arm. It's worse at night, or if someone is consuming alcohol, it's going to make it worse as well, so that's going to be an important question to ask. As far as treatment, NSAIDs are going to be your best option because what's happening is just an inflammatory response is occurring and increased blood flow. And it's most commonly in the proximal femur or the tibia. Now we'll go over to baguettes. So you're going to have a very elevated alk phos value, so lots of arrows, PP, very elevated. And then you're just having normal calcium, and other labs will be normal as well. It's commonly asymptomatic, so you're not typically going to see a younger patient. It's going to be an older patient. You may come in, complain of pain. And then as far as treatment, biphosphonates are going to be your first line option, but you typically don't want to use these for more than 5 years. And then second line is going to be calcitonin. There are x-ray findings that go along with baguettes. So you're going to have bone enlargement with cortex thickening, a dramatic trabecular pattern, and then you're also going to have long bone bowing, and then osteitis circumscriptae of the skull. Thanks for tuning in, guys. We went over bone tumors.